welcome back. We are celebrating National Child Health Week this week.
We certainly are. And joining us this morning to talk more about vaccines is Dr. Tim Davis, and he is with Galen Medical. Dr. Davis, welcome to the broadcast.
Thank you. Thank you. Thanks for having me.
Yes.
I want to begin with a question that's probably at the top of everybody's mind. It seems like a lot of the younger parents nowadays are dead set against childhood vaccinations. Not all of them, but a pretty big percentage are. Why do you think that is?
Well, I think that is because a lot of people, not just younger people, but a lot of people are suffering from bad information. You know, they read on the internet that this vaccine caused this thing in that kid, when the fact of the matter is there's no good data that shows that vaccines, any of the vaccines, are associated with autism or any other neurodegenerative diseases, and that the main side effect of vaccines is that you don't get the disease.
Right, that's the benefit.
Yeah, that's the benefit of the disease. And you know, there are a few people in the world who for some medical reason cannot safely get vaccines, and they get protection from the herd immunity because most people get their vaccines. Those who can safely receive vaccines and don't get them for whatever reason are simply riding the herd immunity, and I think it's not good citizenship.
Let's talk a little bit about flu season. It's coming.
It's here.
It is.
It's here.
I've heard that you guys have already had some cases, and even in your office.
For 3 weeks, we've been seeing influenza A and B.
In your opinion, do you think it's going to be worse this year or a little bit better?
Well, my crystal ball's in the shop. But
You've already seen the cases, I guess.
Yeah. The kids don't seem as sick, you know, with these particular strains of flu that are going around, but it's hard to say because it can mutate, you know, during the season. But you know, we're trying to get everybody immunized before, you know, it really hits.
Is it safe to say that parents who do not get their child immunized from flu and everything else, they're playing the odds, right?
They are playing the odds, yes. And you know, we're lucky in this country because most people get their vaccines, and there is a good herd immunity. We don't have polio in the water. That's why we use the injectable vaccine rather than the oral vaccine. But out there in the real world, in the third world, we still use the oral live vaccine because although there's some slight risk of getting the disease from the vaccine, it gives you much better gut immunity, which is how you get polio.
And we're talking about Child Health Day today, and you know, shots are important, but also maintaining a healthy lifestyle, other things. Talk to us a little bit about what parents need to be doing to make sure their kids are staying healthy right now.
You need to be feeding your children a healthy diet, and you need to help them get exercise. The American Academy of Pediatrics recommends 1 hour a day of strenuous physical exercise. That's where you sweat and breathe hard and your heart beats fast. 1 hour a day, 5 or 6 days a week. I don't know hardly anybody in this country that, you know, adolescents or school-age children that gets that much exercise. And the one thing that you can do is turn the video games off.
It's true.
Yeah. Unplug the kid, send him outdoors, you know, or her. And
in a nutshell, medically speaking, there's no hardcore evidence that there is a downside to getting these vaccines.
None whatsoever. Like I say, the main side effect is you don't get the disease. You may get a little sore. You may get a little fever that day. Or with the live vaccines, 7 to 10 days later, you may get a few little red bumps, you may get a fever, but as far as serious neurological complications, they simply aren't there.
All right. Well, thank you so much, Dr. Davis, for being here and giving us this information.
Pleasure meeting you.
It's so good to see you. Yes, thanks so much for being here. Thanks for the information.
I think we got a new doctor on the house call.
Sounds good.
All right, let's get the information here on Dr. Davis. He is with Galen Medical. If you would like more information, you can contact them at their website, which is
GalenMedical.com.
All right, thanks so much. Stay with us, everybody. We'll be right back.